addressing the myths and facts related to breastfeeding and breast cancer. So, as you're aware, Neolacta's motto is to make sure every preterm baby gets human milk-based diet. And knowing that breast cancer is also quite, it's something which bothers every woman, and there's also high prevalence of breast cancer. Let's understand the breastfeeding and breast cancer along with Dr. Neeti. So, in order to give a brief introduction about Dr. Neeti, so she has done a MBBS and MD and Gandhi Medical College, Bhopal, and she's done her AM in the Cancer Institute, RDR, Chennai. And she also has few fellowship in her hand, and she to every medical student, I think she'll be an inspiration because she is a gold medalist in several subjects, and she has also got the President Awardee, India President Awardee. And thank you so much, ma'am, that you have joined the session at Neolacta addressing this. And I think every woman, once they hear this, this will be very useful for them to understand the importance of breastfeeding and also to understand how they can prevent and many more concepts related to breast cancer. Thank you so much. Over to you, ma'am.
Thanks so much, Dr. Harini. First time seeing you, and that's lovely. Thanks to Indigene for inviting me today. And it's kind of an interesting topic to discuss. Thanks for giving me the opportunity to talk on this. Let me start by saying, why is breast cancer important? Why are we even discussing this topic? And let's understand that for women cancer, breast cancer happens to be the most common cancer. 1 in 4 women, if they have cancer, is only breast cancer. So 26% of Indian women with cancer only have breast cancer. If you put both the gender together, even then breast cancer is a leading cause of cancer in our country. 14% of all cancers are only breast cancer. And the unfortunate part here is that, well, it also happens in young women, especially in Indian subcontinent, in South Asia and in East Asia. We see a lot of women in their 30s and in their 40s having breast cancer. And these are also the cancers which happen during pregnancy, just before pregnancy, just after pregnancy, which are known as pregnancy-related breast cancer. And then, of course, since it happens in young women, fertility issues otherwise are very important because survivorship of breast cancer is extremely high. So these women will always have issues about how to carry on with their normal life, including fertility needs in future. So all young women who come to us, first question we have to ask is whether they want to preserve their fertility or not. And if there's fertility preservation, then we have to give them specific options to preserve fertility during breast cancer treatment. And then subsequently, when they are treated effectively, tell them that this was a more suitable option and they could actually go ahead with the same. So I'll be addressing certain myths and facts related to breastfeeding and breast cancer today. And let me start by first discussing the importance of breastfeeding, because I think that's the center point when we are talking in a platform like this. Then I'll talk about causes and risk factors of breast cancer, signs and symptoms, diagnosis, how do we manage it, and what are the advantages of breastfeeding in a patient who has had breast cancer, or potentially, you actually have had in the past, or you have been diagnosed during pregnancy as well. So first thing is, well, what is the importance of breastfeeding? Breastfeeding is a natural process and the best way of feeding infant. Breast milk provides optimal nutrition, both for preterm and full-term infants. Breastfeeding offers several benefits to mother and infant both. What are the advantages to the mother? Well, they burn almost 500 extra calories each day, and this keeps them fit. Longer breastfeeding not only takes care of certain cancer-related factors, but commonly it has been known to have protective effect on type 2 diabetes, high blood pressure, and including heart disease, again, because of change of hormonal profile. Breastfeeding is definitely known to lower the risk of breast and ovarian cancer. And of course, it releases oxytocin levels during the postpartum period, which causes contraction of the bleeding uterus. For the baby, well, we all know it provides optimal nutrition for growth and for development. Breast milk provides immunity and protects kids. Breast milk is easier to digest and prevents short-term and including long-term health effects. And of course, it builds bond between mother and baby. It also provides neurodevelopment for the newborn. Understanding breast cancer. So what exactly is cancer? Any uncontrolled growth of any part of the body is called as cancer. When it is in the breast, it is called as breast cancer. What exactly is the distribution of breast cancer? So we have certain ducts which open in the nipple. And if the cancer arises in the duct, it's called as ductal carcinoma. And when it is connected to a lobule and cancer arises in the lobule, it is called as lobular carcinoma. So it could be ductal or lobular carcinoma. An early stage or even a pre-malignant stage is known as ductal carcinoma in situ or lobular carcinoma in situ. What are the common causes of breast cancer? Well, about 10% of patients will have family history. And family history actually means that if your first degree relative, which means either your parents or your brother, sister, or your kid has cancer, it's called as first degree relatives. This is very significant in breast cancer. For certain type of breast cancers like male breast cancer, family history forms almost 20 to 30% of instance. If for bilateral breast cancer, again, family history is extremely important. There are certain genetic mutations which are inherited from parents to kids. And these genetic mutations can also lead to cancer. Some of them are PAL-B2, BRCA1, BRCA2. I'll talk about hormonal factors later on. But increased breast density, especially in young women, can also lead to cancer. Prolonged use of oral contraceptive pill. This is a controversial topic, but it leads to cancer. And surprisingly, when the use of OCP stop, the increased risk of breast cancer also comes down. Alcohol intake and the glasses you consume, more the number of glasses or more the alcohol consumption, increased is the risk. How do we diagnose breast cancer? Well, any lump in a woman should be investigated, whether it's in 20s or it's in 30s or it's in 40s. Most common presentation is a painless breast lump, but other presentations could be just a puckering of the skin, that is unhealthy skin. It could be persistent itching or redness in one part of the breast. There could be nipple changes, including persistent nipple discharge when you're not breastfeeding. It could be in retraction of the nipple. There could be redness and skin changes, which I said, and also lump in the neck and the underarm areas, which could cause suspicion of a cancer. Self-breast examination, especially in our country like India, still holds very important value to self-diagnose cancer. What are the few things which we commonly advocate? In your 20s, do a monthly self-breast examination. In your 30s, go to a clinician for a 6th monthly clinical breast examination. And starting from 40, once a year or 1 in 2 years, a mammogram is recommended. For younger women, an ultrasound is generally recommended to make sure that you are not missing in case of a dense breast. MRI of the breast is also recommended in certain situations. And more often, this MRI is done when there's a strong family history. Once you have suspicion, we normally ask for doing either an FNAC or a biopsy of a suspicious lesion. And once the biopsy confirms it's breast cancer, then you subtype it. You subtype whether it is hormone receptor positive or negative, whether it is HER2 positive or negative, and what is the multiplication index known as a Ki67, whether it is high or low. Based on that, you subclassify breast cancer. Then we stage cancer, which is done by either a CT scan or a PET CT. And based on the subclassification and the stage, we decide what will be the treatment. So there's a basket of options. And most of the time, breast cancer is treated with multiple modalities. That is more than one modality. Commonly, surgery, chemotherapy, and radiation therapy are used. Often, 70% patients will require hormonal therapy, which is often in the form of tablets. Neotherapies like targeted therapy and immunotherapy are also used from time to time. So as I said, a good breast health plan includes monthly self-examination, 6 monthly clinical examination in your 30s, mammograms starting from 40s. There are various modalities of screening otherwise as well. like thermal screen and many other devices, which could be done in smaller places where such facilities are not available. But at the same time, the definitive modalities include any suspicious lump being confirmed by a needle test, which could be a fine needle test or a biopsy. Now, I want to dwell on the topic which is important to us, which includes hormones and its relation to breast cancer. So, we have to understand that breast cancer is driven most importantly by estrogen. And how does estrogen increases risk? Well, when we have early exposure to hormones, that means early menarche, a late menopause, which is normally more than 50 years of age, a late onset of first full-term pregnancy, nulliparity when you don't have a kid, obesity, which again exposes you to endogenous estrogens, and hormone replacement therapy, which is known as exogenous estrogen given during menopause. These all exposes us to increased level of estrogen, which could be either produced from yourself, it is endogenous, or exogenous. And all these factors increases the risk of cancer, especially breast cancer. We have to understand that every year the menarche is delayed, we prevent breast cancer risk by several folds. So, now we see often healthier kids who have had good nutrition level, and therefore early menarche is an outcome of it. And therefore, yes, there's increased risk of hormone exposure. How do we decrease risk? There's something known as iatrogenic risk reduction. Honey, you can hear me clearly?
Yes, ma'am. It's clear. Please go ahead. Yeah.
So how do we decrease risk? Well, estrogen deprivation is the bottom line. So how do we deprive certain indications and where ovaries are removed, known as iatrogenic menopause, where oophorectomy or removal of ovary is done for any medical condition, also reduces the risk of breast cancer. There is 20% decrease in risk with each 1 year delay of menarche. So instead of 10, if you have menarche at 14 years, you're significantly delaying the risk of breast cancer. Complications related to pregnancy, that is full-term pregnancy in a younger age, surprisingly confers protection. And there is a study which says that if you are pregnant at 18 or if you're pregnant at 30, a woman who was pregnant at 18 would possibly have much more protection to cancer. Breastfeeding, which is again topic of the day, particularly for longer duration, is known to protect against breast cancer. So there's a combination of reproductive history and a combination of breastfeeding, which is our focus here. According to WHO and UNICEF guidelines, at this juncture, breastfeeding is recommended for 2 years. It's as long as possible, but then yes, 2 years. For every 12 months, a woman breastfeeds, there's a risk reduction of about 4.3%. For 2 years, 2 children each can cause risk reduction of almost 31%. Mothers who breastfeed for more than 2 years benefit most in terms of breast cancer risk. And women who are BRCA1 positive, that is, who have a genetic mutation, who breastfeed again have risk reduction of almost 22 to 50% if they have breastfed for more than 1 year their babies. Also, what it does, breastfeeding does, it discards cell. Now, this is a hypothesis. I think we need to dwell on it more to understand how much it's true. But they say that it removes the cell with impaired DNA and therefore confers protection for breast cancer. Importantly, yes, it reduces estrogen levels during lactation, which minimizes your body to exposure of the hormones, which promotes tumor growth, causing breast cancer, and definitely increases immunity, and immunity not just for infections, but also immunity to fight cancer. So I will let you all ask me any questions now.
Yes, thank you so much, ma'am. This was such an insightful presentation. This gives us a gist of like the breast cancer and what is the screening needed, and also the importance of breastfeeding here. So I would want to, let every attendees know, if you have any questions, please add it in the chat section. And this is also live streamed in YouTube and Facebook. If you have any other questions in future, once it is posted, you can please post your questions in the comment section, and we will get back with the answers from the experts. So, ma'am, I have a few questions now that the topic is addressing myths and facts related to breastfeeding and breast cancer. Should a mother worry, let's say, because now most of the working women, there are many challenges that the mother don't get a chance to breastfeed the baby for the duration as recommended by WHO and UNICEF. Should a mother be worried that they have a higher risk of breast cancer?
Arni, one thing is wherever possible, expressed breast milk is an alternative. And of course, I mean, that's something which we all should focus on. Even at workplace, a working woman can use those facilities. Big workplaces design chambers and design area where you can actually do express breast milk collection and storage. When you go back home, you can keep it in your refrigerator. So use those facilities. But then, yes, there are certain things you really can't change. And if you have really not breastfed, I mean, we cannot hold too much guilt about it. But yes, there's a factor which reduces risk. And if it is done at the right time for the right duration, it helps.
Yes, thanks, ma'am. So I think that this is the key message, that every mother should make an attempt to breastfeed or express the breast milk so that you can keep up the cycles and reduce the hormones level here. So especially the estrogen. And also, ma'am, now in your slides, you also mentioned that the breast milk, the sheds the cells. Now, knowing that, let's say if it is shedding the circulating tumor DNA, does that transmit cancer in the child?
So ctDNA or circulating DNA actually is known as cell-free circulating tumor DNA. It's a very vastly discussed topic in oncology circuits. And we use ctDNA. It is standardized when you do it from plasma or from blood. We quantify the level of circulating tumor DNA to decide whether the burden of tumor is high, whether response is happening, and then the burden of tumor comes down. But at this juncture, fluids or breast milk may express ctDNA, but we really don't know what is the value of it. Whether it transmits in a kid or not is really uncertain. So I don't think we can actually kind of make landmark changes based on that. And at this juncture, it is recommended to breastfeed. If you're not on treatment, if you're on chemotherapy or if you're in any other treatment, please check with your oncologist before taking up for breastfeeding.
So the message here, ma'am, irrespective of the cells being transmitted, the mother should not fear to breastfeed a baby. So one has to continue feeding. And also,
Yeah.
ma'am, like now, there's a fear in most of the mothers. Let's say there is a family history of cancer. And she has the fear that, okay, if I breastfeed, probably I'll have cancer. Or, there's a lot of tension in their head. So what do you have to say for such parents?
You always understand, if you have a family history of cancer, go to an oncologist or a genetic counselor, discuss your history. Any member of the family having cancer doesn't mean you are at risk. You have to figure out what is your individual risk. There are various risk assessment models in which we decide what type of cancer was in a particular family member, at what age, what was the subtype. Even if there was breast cancer, what was the subtype of breast cancer? So what age, what subtype of cancer, who was the first degree relative, second or third degree relative? And based on that, please assess yourself. There are some tests also which are recommended if you have family history. So there could be a genetic testing in the form of saliva swab testing or blood test, which determines whether you are at risk or not. So before conceiving, if you want to do this test, you can please go ahead and discuss with your oncologist, get your history screened, get yourself tested before you conceive. If you have a baby, the breast milk will transmit that genetic factors? Answer is absolutely no. If at all it is going to be transmitted, and if you have a genetic mutation, then your blood will do it anyway. You have conceived the baby. But at the same time, there is no evidence to say that breast milk is going to transmit the genetic risk to the baby.
Perfect. Thank you so much, ma'am. I think this is something like we have to break the myth, like, history hai, it'll transfer in the breast milk and it'll transfer in the to the baby. It's a no. So don't stop breastfeeding. And now that we are talking about breastfeeding, I want to understand, like, what is the risk of breast cancer in men, and if they have cancer, What is the aggressiveness? Is it like it just happens in stage one, or it'll be a metastatic stage? How is it?
So 1% of incidence of breast cancer is in men. If you have 99 women who have breast cancer, one male also will have breast cancer. And male breast cancer is most ignored. That's why it's missed very easily, because men are not suspecting that they can have breast cancer. So a chest wall lesion may be very suspicious, and they'll wait and wait and wait without understanding that it could be a cancer. Lumps are definitely ignored. And only problem is when men come, it becomes a little more advanced because it has been ignored for a longer time. Yes, there's more familial breast cancer in men than in women. Often male breast cancer will have some family history, but which is again tested by doing certain tests like blood test or saliva swab test. And they are treated also slightly differently. The hormones we use are slightly different, but by and large, men can have cancer, and you just need to treat it correctly. Again, the results of male breast cancer are better than other cancers. So remember, whether it is male breast cancer or it's woman breast cancer, it is treatable in all the stages, and it does much better than, I mean, most other cancers.
Now, let's take a situation. We have a mother. Now she is in the third trimester, and she's diagnosed with breast cancer. And as a mother, everybody would want to breastfeed a child, and the tumor is in one breast. Is she allowed to breastfeed in the other breast?
Well, this is a very tricky
हर हफ्ता
question.
तो नहीं लगता, वो महीना का एंड में लगता है, मतलब आपका
Please,
प्रेगनेंट डेट नहीं लगता हेड
I
ऑफिस
would request to please mute yourself.
Praveen Sharma.
Praveen Sharma, please mute yourself.
So,
Please go.
what happens
I
is,
think yes, ma'am.
what happens is that pregnancy related breast cancer anyway are suddenly missed, because at that point in time you are already having certain breast changes. And most often, even if you visit your doctor, they will actually conclude that it is breast changes related to pregnancy. And therefore, often pregnancy related breast cancers go unnoticed or misdiagnosed. Any suspicion, even in a pregnant woman, should be investigated. If she's already in the third trimester, then you have to think of two things. One is maternal health and fetal health, because the baby already now is not, I mean, you have to deliver the baby wherever required. We actually ask for early delivery, I mean, whether it is induced or it is kind of. So one thing is, if the baby is there, and then and you cannot induce a delivery at that point in time, then you have to modify treatment suitably, which is safe for the fetus and safe for the mother. All the chemotherapy drugs can still be done during third trimester of pregnancy. There are certain biologic therapies which are excluded, but any time during pregnancy and when the baby is delivered, breastfeeding cannot be done if the patient is on certain drugs. So go and talk to your doctor. Simple thing is, if you have had a surgery and you're put on certain antibiotics, even then breastfeeding would be restricted. Please go and talk to your doctor which are the drugs which are secreted in breast milk, where you should avoid feeding your baby.
Okay. So let's say if the mother is put on radiotherapy, can the mother still feed the baby?
On radiotherapy, breastfeeding can be done from the other breast. Yes.
Oh, that's great to know, ma'am. So now again coming back to chemotherapy, is all the chemotherapy, if she's on chemotherapy, like is there any relevant drugs to say, okay, if she's on this specific drug, mother can breastfeed, or in this group of drugs she should not, or would you avoid all the drugs?
Please talk to your doctor. Most often, drugs, when they are given, your breastfeeding should be avoided. But who has been treated for cancer in one breast can always feed from the other breast if she's currently on no active treatment.
Okay,
And
currently. Ma'am,
from that
yes.
breast, if there has been a breast conservation surgery and she has milk production in that breast, she can feed from both the breast.
Ma'am, and also knowing is the breast tumor, like when she's diagnosed during the pregnancy, what is the aggressiveness like during pregnancy and postpartum? What is more severe?
See, the terminology called pregnancy-related breast cancer includes during pregnancy and postpartum. And both, there are a lot of divergent group of thought process. But as I said, most often it is delayed and therefore it becomes late stage. And therefore it is kind of more aggressive because the presentation is already advanced. Second thing is younger women generally have more aggressive disease in general. But third thing is that we have to titrate treatment to quite an extent if you're preserving fetal health as well. If the woman is still pregnant, then you have to preserve fetal health. So anti-HER2 therapy, biologic therapies cannot be given. Certain type of hormonal therapies cannot be given because you may cause more harm to the fetus. So that time, certain treatment alteration may also affect the overall outcome.
So it's all of strategy and the stage of the tumor. And I think as your expert, so it also depends on the treatment, how it goes. Ma'am, and as per your experience, what has been the outcome, especially with breast cancer during pregnancy? Like how has been the, if you give us an example of, any like experience as per your practice.
If a early stage breast cancer is diagnosed in pregnancy, the outcome is very good. If and generally from if the woman is diagnosed with pregnancy related breast cancer in third trimester, generally most of the treatment is not compromised, and the fetal health also can be preserved with good outcome, with good fetal outcome, and maternal health, at least in terms of in terms of malignancy, also can be done adequately. You can start with chemotherapy, which does not affect fetus in a big way, even though there's a maternal fetal barrier. Even if it crosses, it doesn't do undue harm to the baby. We can deliver the baby safely and continue with the treatment. And the outcomes of early stage breast cancer is generally good. But there are a lot of permutations and combinations, Harini. It's not one answer. See, if it's a triple negative breast cancer, outcome is very different. If it's a HER2 positive and you delay HER2 therapy, it's a different outcome. So, well, yeah, generally 60-70% will be hormone positive, and early hormone positive breast cancer will generally do okay.
Now we are dealing with, several breast cancer. What is your suggestion for the genetic testing? So how frequently should they, test for the genes?
No, it is not a routine procedure. Let's start with this.
Okay.
You please go to
Okay.
a doctor, get yourself established. What are your risk factors? Your obesity, alcohol seem to be more important factors than your genetic history. Your other factors, like your reproductive history, has more significance than your genetic history. Only 10% will be genetic or familial or heritable breast cancer. 90% will not be. So get your history examined. If your doctor feels that you have pertinent family history, then they will get you tested. And you just test yourself once with a good test modality. So it should be done at the right time. There's normally multi-gene panels is what we use. If you have been tested once and if you are negative, you don't have to redo it. If you're tested positive, then you will be recommended a different set of screening investigations altogether. There are certain risk reduction procedures also which will be advised to you. You will be told you should do this, that, and based on your age and your personal, like if you want to complete your family, what needs to be done. If your family is already complete, what needs to be done, or you're at a certain age, you will be told age specific risk reduction strategies.
Is specific. Okay. Mom, also now knowing that the breast cancer is always, do you recommend a surgery or is it only treating via chemotherapy or radiotherapy?
No, see, it is a multimodality treatment. All modalities are used for less than stage 4 disease. Stage 1, stage 2, stage 3. Generally, multimodality therapies are used, and everything is sequenced in a certain way. Whether I want to start with immunotherapy or chemotherapy, whether I want to start with biologic therapy, whether I want to start with surgery, everything is based on the molecular subtyping of the cancer. So everybody is an individual. It's not a formula we use. Everything, whether you sequence it with surgery first, followed by the next treatment, followed by radiation, there's a sequence for a particular logic, whether it is what size of tumor, what were the lymph nodes, what was clinically resectable, your objective was breast conservation or mastectomy. Based on your objectives, you decide how to sequence the treatment.
So it depends on completely the staging and the nature of the tumor so that one can decide if it is therapy or so. Okay,
Absolutely.
thank you. Yes, ma'am. And also now, there are like few articles, they say, can breast cancer be diagnosed from breast milk?
Again, your same question, ctDNA.
Yes, ma'am.
Circulating tumor DNA is again a very debated topic. There have been
Okay.
studies in which they say blood can diagnose possibility of you having cancer. Well, the answer is this is a research area. We don't know as yet. There are studies which say that yes, you shed certain type of tumor DNAs which can detect in breast milk, or whether it can detect in your blood, or it can detect in any other fluid. Like for urinary tract cancer, whether you can do urine analysis and check. All these things are, yes, they are hypothesized, but there's no definite proof right now. So answer is we don't know, and there's no testing modalities which tells you to do it now. No.
Great, ma'am. And also, like now, ma'am, you did mention that there's a painless lump. So is always the breast cancer, the tumor always painless? Or should one be worried if there is pain as well?
No, no. So any breast lump, you should get yourself examined, painless or with pain. Yeah, it can be painful lumps are very common in young women and may not be cancer. And very advanced stage cancer also can have painful lumps. So pain is one of the symptom as well. So any unusual thing you notice which is persistent in the breast, you should bring to attention. Mastalgias or breast pain are very common during periods. This is known as cyclical mastalgia. Every cycle you have breast pain. That aside, well, you should bring any unusual thing in your breast to medical attention.
Yes, ma'am. As you mentioned, the cyclical mastalgia, because some of the women's, they have this pain in the breast during the menstruation or just premenstrual cycle, and some of them also like have this firmness in the breast. So should they fear that they are risk for breast cancer?
Again, get yourself examined if you have any doubt. Self breast examination, so you can note from month to month change. If there's a persistent, unusual change, and especially asymmetry in the two breasts, you should get yourself examined once. But it is very, very cyclical during periods, few days prior, few days after. And there's a pattern of breast engorgement, not a focal lesion, not a localized lesion, but generally breast engorgement and fullness. That may not be a symptom of cancer.
Okay, so ma'am, also like is always breast cancer unilateral or bilateral?
It can be both.
It can be both. So it's no specific, but it can be either unilateral or bilateral. Again, it's up.
Often it is unilateral. When it is bilateral, we see whether it is metastatic and therefore it has gone to other side, means it's in other areas and other breast, or it's only in the breast and not metastatic. So it could be bilateral breast involvement without metastasis or with metastasis. But yes, both are possible.
Yes, ma'am. And also, like, what would be the cure rate for the breast cancer? Like having many multimodal therapies. What is the cure rate?
So 5-year cure rate, so survival rates. 5-year survival is what oncologists say. So 5-year survival rate of stage 1 breast cancer could be in the tune of 90% and above. It's an extremely, if you're early stage breast cancer with good risk factors, you may have an extremely good survival. So I told you that breast cancer is the most common cancer, but breast cancer is also the most common cancer with the maximum survivors. That we have to understand that maximum cancer survivors are breast cancer survivors. And that's why we talk about breast cancer so much, because we know that this is an area which can be treated and handled very effectively.
Thanks, mom. That's great to know because every woman they fear this breast cancer. It's good to know that most the cancer which has the highest curable rate is breast cancer here. And also, if you have to advise now in this modern society, most of the children's men, women are deviated towards like modernized food with these pizza, burgers. What do you have to say when it comes to food and related to breast cancer?
Well, yes, cancer is a lifestyle disease as well. And changes of lifestyle, sedentary lifestyle, your more Western dietary patterns, obesity, yes, it contributes as well. High fat content in diet, all contribute. Some discussion around red meat causing. So changing dietary patterns and our more sedentary lifestyle does contribute to cancer, breast cancer.
So, and also knowing that, ma'am, yes, definitely, irrespective of breast cancer, I think any other cancer also lifestyle modification would be very important. And knowing that the cure rate for breast cancer is very high and it's also better compared to the others, is the management, very like cost is one factor which impacts everybody's mind. Okay, I have cancer, now I have to spend so much. So, what are your thoughts on this?
Harni, yes, oncology is an expensive treatment because of technology. You should understand what is used in oncology requires a lot of skill of certain nature. It's not, I'm not talking about manpower. What I'm talking about infrastructure related things, which is expensive. The drugs which we get are expensive. The manufacturing of the drugs are newer drugs are expensive. The procurement channels are expensive. So certain elements of treatment are expensive on an average as compared to other things. But again, success rate has increased because of these newer modalities. And also India has done there are a lot of measures to bring down the cost. We have Indian make drugs which have made it cheaper. We have the same technology which is made here, which is becoming cheaper, whether it is precision radiation, whether it is precision surgery, whether it is diagnostics. You won't believe that if I'm in the United States and if I do a PET scan, it requires me a whole lot of long appointment and the cost can be exorbitant. But when we do the same PET scan in India, it's fraction, means it cannot be as cheap as any other country cannot have it as cheap as here. So the practices in our country have changed because we find that certain things are very approachable, very cheap because of indigenously made products.
Yes, mom. I think I do echo with you. The facilities we have in India, we don't have that abroad. It's very easy for us, easier for us to approach any specialities for that matter, from cancer to any other disease. It's easier, and it's also we get the diagnosis at an early stage, tests done at an early stage. And even I have experienced it. To get an MRI, I had to wait for 3 months. So, but in India, it doesn't happen like that. So, people
No, but
should need to
Harni,
understand.
sadly, that you go in the morning, by evening, you have half of the test in your hand, reports in your hand, with but still we complain. I
Yes, ma'am.
think I think what we need to do is understand that this is a remarkable healthcare system. Nobody understands that India, we cannot be,
Yes.
we have the best of everything. People travel from Europe and America just to do certain tests and go back. Do some basic things and go back. For them, including travel and stay, it is cheaper doing treatment here and doing a diagnostic here than doing in another country. So we should be appreciative of our health system. I think we are not seeing the brighter side of things at all.
Yes, ma'am, absolutely. As you said, why people are not seeing the brighter side, but just complaining on other facts. So that's a problem. And ma'am, now you did mention initially, like to have early screening. So if you could reiterate again, how often should a woman get screened for breast cancer?
See, let's talk about just breast health. In your 20s, start examining yourself. It can be even earlier than that, once a month. You make a date which generally should not coincide with your periods because that time you have engorgement pain. So maybe you should do around mid-cycle or have it first of every month or 15th of every month in your telephone reminders that yeah, you will examine yourself. Self-breast examination, look at a YouTube video. It could be circular motion, it could be zigzag motion. When you're examining your breast, also examine your underarms and your neck. From your 30s, go at least once to a doctor. Check whether you fall in standard risk or high risk, where you need something else. For a standard risk category, once in 6 months, get yourself examined by an oncologist. But during that time, other things also you should think of, not just breast. You should probably talk about your cervix, and see if a pap smear has been done and HPV testing has been done, or if anything else is required. From your 40s, you can start doing your mammogram on your 40th birthday. And if they tell you it is dense breast, which is difficult to comment, then we always have to add an ultrasound to it. Only mammogram may not be sufficient. We'll add an ultrasound to it every 1 to 2 years. Actually, from 50 years of age, every once a year you should do mammogram. But in India, we have cancers happening a decade earlier. So what happens in 50s and 60s abroad, we happen in our country, it happens in late 30s and 40s. So we should start screening ourselves from our 30s, and from 40s, mammogram and ultrasound is required.
So, thank you, ma'am. And we have a question. So they've asked, like, in case if in India, when you have your periods, you're not supposed to go to temples or attend the pujas, all that is there. And what they have been doing is they start taking pills to postpone the periods. So, is these pills, associated with high risk of breast cancer?
Long-term oral contraceptive use is associated, not short-term, but long-term continuous use is associated. But I don't think for that reason you should be delaying your periods all the time.
Yeah, absolutely. It's always the hierarchy people, it's important, they just delay it. That's what keeps happening. It's good to know, ma'am. But as you said, I think lesser the use of oral contraceptives, it's always better. Now, coming for like nulliparous women.
There are other methods of contraception which are safe. So
Yes, no, agree. So, ma'am, and also should a nulliparous woman be worried, for the risk of breast cancer? What do you have to say? Because it's a multifactorial again. And here we are dealing with breastfeeding, pregnancy, and breast cancer.
So it adds to your risk because of increase of hormone life, exposure of estrogens for a longer time. But again, what cannot be changed should not be dwelled upon.
Yes, ma'am, absolutely. So I just want to let the audience know, Dr. Neeti practices in Fortis Hospital. She's the senior consultant, senior director, and consultant hemato-oncology, medical oncology. So she please do visit her if for any complaints. Like she mentioned, it's very important to get the consultation for any questions related to any cancer per se. Yeah, ma'am, and also before we end the session, what would be your key messages related to breastfeeding and breast cancer? Like top key messages for every attendees here.
You have given the right message. So this message should go from you.
Ma'am, we are the experts, so we would want it from you so that it stays strong.
We have heard of so many positives. I mean, I mentioned so many positives about breastfeeding. So wherever possible, as long as possible, breastfeeding can help in not just, not just preventing cancer, but more important things like emotional bonding, like giving the right nutrition, keeping your weight in check. So please focus on the right things.
Yes, absolutely. Thank you so much, ma'am. Thank you so much for your valuable time. I think we had a great discussion, giving a lot of information related to breastfeeding and cancer. So this session will be, it's recorded and it will be posted on YouTube, Facebook, and Instagram as well. So people who have missed can always view if you have. And in case if you have any questions, additional questions, feel free to add in the comment section. We will get back to you. But thank you so much, ma'am, for your valuable time. It was a great session. Thank you, everyone. Have a great day ahead.